What's up, everybody? I'm Ben Simmons, first year medical resident. I'm so glad to be back. The first few months of residency have been crazy. Learned so many things along the way. I definitely wanted to impart some of that wisdom in this video right here. We're gonna start with the do's and don'ts of how to effectively communicate with nursing teams. If you're in the medical field, you definitely wanna stay tuned, and you're definitely probably gonna have some opinions on some of the things I'm gonna say. And if you're not, it's important to know how to follow along with the doctor shows that you're watching on TV. And when it's your turn to be in a medical setting, you can observe the communication of the nursing teams with the physician staff and see if you notice some of these things as well. Stay tuned. Rule number one applies to every life situation, medicine or otherwise. There is no superiority of one person over another based on the letters at the beginning of your name, the letters at the end of your name, MD, PA, RN. It doesn't matter. No human being is rightfully better than another human being, and you have to act accordingly, especially in medicine when the care of the patient depends on effective communication and people working together. For instance, a resident is the person that can order the medicine on the computer, but only the nurse has access to the actual room where you can get the medicine and give it to the patient. So without them working together, those things would never happen. Not to mention that as a first year resident, you probably literally know less about everything about the hospital than the nurse. They know the logistics of the hospital, how orders work, how the geography of the rooms are set up, everything better than you do. And a lot of the medicine they know better because they've been doing the same thing on the same set of patients for a long time. Now, rule number two goes along with rule number one, and that's to always be kind to everybody around you. And I know this can be tough because sometimes you're like, man, I just worked 12, 14, 16 hour back-to-back shifts for 13 days straight and you want me to be nice to every single person? But yes, that's exactly what I need. That's exactly what the hospital needs. And I think it's very possible to do as long as you set a script for yourself and you stick to that script every single time. So for instance, every time you pick up a page, you say, hey, it's Ben from medicine. What can I do? Or whatever works for you that makes sense, instead of picking up the page and answering like, what do you need? Did someone page me? What's going on? That already sets the energy off wrong, and people are more likely to make mistakes when you have that type of tension and energy. So always stay pleasant. Make sure you have a script for yourself so that on the bad days, you can still create pleasant energy. Now, if you believe in teaching and learning in cooperative environments, rule number three might be the most important. It's to always explain your thought process. If a nurse calls you about a high blood pressure and in your mind you know that there's no need to treat it because either we're adjusting a patient's meds so that we can figure out their home regimen, or that you don't want to give them a certain blood pressure medication because their heart rate's already high and you don't want them to have a reflex high heart rate in reaction to that blood pressure medication wearing off, whatever the reason may be, describe that to the nursing staff that's calling you to tell you about the high blood pressure. Don't just brush them off. You want to have good communication. You want to be able to teach and learn from one another. So always explain yourself and ask their opinion too. Say, okay, I don't think we should give them blood pressure medications right now. One, because it's late at night, and maybe let them sleep. The day team will readjust their daytime medications, and this person has borderline high heart rate that I don't want you to give that blood pressure medication because when it wears off, their heart rate might go even higher. Now, so if you're able to explain all these things and then ask, what do you think? And they might tell you something that you didn't know that may be a reason why that blood pressure medication needs to be adjusted. They may say, well, the surgery team or the neurology team said we need to keep the blood pressures under X, over X. And so you're like, oh, good point. You know what? Maybe we do need to give them something to lower it. Or maybe they'll say, okay, I get it, and then keep moving on. But that's an opportunity for learning that you're missing out on every single time you dismiss somebody's recommendation or suggestion just because you don't agree with it. Now, rule number four is a little controversial, but I still stand by it. And that's to always use your first name with the nursing staff, especially if you're just a first or a second year resident. I know that the medicine hierarchy is very important to the structure of how we learn in medicine and how we operate and how commands get passed down, because that also eventually leads to how responsibility gets passed down, right? The person at the top of the food chain is essentially responsible for all decisions made under them, and that's understandable. But still, when it comes to you introducing yourself to somebody else in the hospital that's probably a peer of yours, around the same age or around the same amount of experience in the hospital, just say, hey, I'm Ben, or I'm Ben Simmons, one of the doctors on this team. And even when you answer a page, hey, it's Ben from the medicine team. Good afternoon, it's Ben from medicine, what's going on? Just constantly, and they know your last name because when they see your orders in the computer, they see Ben Simmons. They know that you're Dr. Simmons. They don't need you to necessarily say I'm Dr. this or this. And granted, for attendings, it's different because the way they operate, the nomenclature and everything might be different. And they don't deal with nurses on an everyday basis throughout the entire day. But for you, that's someone that's going to be a peer, you're going to be working with, you're going to see them all the time, you're going to be passing back and forth information, just go with the first name. It creates everyone to be much more comfortable. They're much more comfortable communicating back and forth. There's no reason to go like, I'm Dr. yada, 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 when you just became a doctor 3 months ago. Just calm down with all that. And rule number 5. Rule number 5 is remember that you're always a team, and teams cheer for each other no matter what, right? So when a patient is complaining about a nurse, never talk bad about that nurse or say you're going to get a different nurse or anything like that. You always remind them, this nurse is taking amazing care of you. You know, they're doing everything they can. They have a lot of patients. They're busy doing X, Y, and Z things. Remind the patient that everyone is taking the best care of them as possible. And they will return the favor when you may get really busy and forget to stop back at a patient. The nurses will return that favor when you are supporting them just like they are supporting you. And I think that's super important. If you come into a room, you see a nurse interacting with the patient, you remind them, oh, you're in good hands. You have a superstar nursing team here. Everything is going well. You can step back out and come back later. Or, you know, whatever it is. I think it's just super important that you always remember that it's a team, just like any team. You cheer each other on no matter what's going on. No going behind the back and talking shady to anybody for any reason. Just give a reassuring support of whoever that person is. And it'll be better for the patient. It'll make the patient feel more comfortable, like, okay, I am getting cared for different. Maybe I thought somebody was making a mistake, but I am getting cared for well. Just a reminder makes everyone feel more calm.